Should you be having circulating tumor DNA testing done? In this video, I'm going to be talking about circulating tumor DNA, what it is, what it might be used for, and what the current status is of this particular technology. Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content, so there's always something new to watch. I'd also love to invite you to go to Yerbba.com to get your personalized Yerbba report. Your Yerbba report is created by taking all the information that you either upload with us or give us permission to access through your electronic health record. It creates a personalized report that is updated as new things are done and new things happen in your life and new things are known about your cancer. It then creates a report that shows you all of the treatment options you might hear about when you go to doctors and the pros and cons. There's also a feature that I like that helps you ask questions of your doctor by showing you really common questions that people take in and questions that our team members are prepared to answer. I love that feature. The other thing is if you get the premium version, you can access Ask Yerbba, which is asking questions in real time about your specific case. So go to Yerbba.com to get your Yerbba report. All right, so what is circulating tumor DNA and what is it good for? When tumor cells die, they release their DNA, their genetic material, into the bloodstream. We can detect circulating tumor DNA in blood tests, which is an exciting technology. We can, with this information, identify people who may have a relapse down the road. If we see circulating tumor cell DNA in a blood test and we don't see it elsewhere in the body when we do scans, this might tell us or be a harbinger of disease that's going to come back somewhere down the road. And in fact, studies have shown that a molecular relapse, which is what this is referred to, can predate a radiographic relapse, a relapse we can see on scans, by even over a year. So this sounds good, right? I can detect a recurrence earlier. There are a couple problems with the test. The first is that we don't actually have proof that detecting a cancer recurrence earlier will improve your outcome. It certainly does change your life. Knowing that the treatment you've had hasn't worked well enough will change your life. And yes, if you're on endocrine therapy, your treatment can be changed before you have that clinical relapse that we see on scans or that causes symptoms. Really, this is great for the drug companies because they get more money because people switch to their products. But the issue is we have no data saying that switching earlier improves survival in somebody who doesn't have symptoms or who doesn't have findings on scans, or even more important, findings on scans that lead to symptoms. So I'd invite you to check out why we don't do CT scans after breast cancer treatment, and we have another video about MRI scans as well that basically cover the same thing. The detecting cancer before it's symptomatic, when it's recurrent, advanced cancer, has not been shown to improve outcomes. The other problem is not everybody with a recurrence has circulating tumor DNA in their bloodstream. So the test is useful if it's positive, in that it says your cancer is likely to recur down the road. But a negative circulating tumor cell DNA blood test doesn't say you won't have a recurrence down the road or you're cancer-free. So while the test is pretty sensitive, we're not entirely sure that it's sensitive enough to lead to the kind of reassurance that you're looking for. If you have circulating tumor DNA in your bloodstream, you're not going to escape scans. You're going to need to have scans at that point to see, can we actually see this and measure it and treat it and know that it's responding? So it's not a replacement for scans in somebody with symptoms. And similarly, it can start a cascade of testing from which some people never escape. So you end up being sort of followed really closely with tests and blood tests and becoming more of a patient than a person. So some people find this to be such a downside that they're not interested in participating in research. So if you have the opportunity to participate in research, this is a great way to contribute to the field and also to have these tests covered, usually by the company or the research study that you're in. At this point, it's promising, but not necessarily ready for use in everyday practice. I hope this has been helpful. It's certainly an area to keep watching, something we're excited about, but we're also cautious about. As always, thank you for watching, and we'll see you next time.